Welcome to Health Diary. My name is Helen Aura and we are coming to you from the Aga Khan University Hospital. We have been focusing on breast cancer and how to detect the disease at an early stage. We touched on an ultrasound, and today on the show we are focusing on what a mammogram is and how to self-breast examine yourself while at home. But first, here is the fact of the matter.
Mammography is an X-ray imaging method used to examine the breast for early detection of cancer. It is used as both a diagnostic and screening tool. Women over the age of 40 are more eligible for a mammogram, and only in rare occasions are women who are below the age of 40 eligible for the test. Compression of the breast on the mammography machine helps to create clear images, as the patient is required to be still. Compression also helps even out the shape of the breast so that the X-ray can travel through a shorter path to reach the detector. While it is good for one to go for regular checkups, another way doctors are urging women to take personal initiative is by doing a self-breast examination. A self-breast examination is an early detection tool that uses a combination of physical and visual examinations of the breast to check for signs and symptoms of breast cancer. This technique can easily be applied from the comfort of one's home. A woman is required to use the tips of her index, middle and forefingers gently in a clockwise manner.
As we continue to delve deeper into breast cancer, today we focus on a mammogram. What exactly is a mammogram and who is eligible for a mammogram? I'm joined by Juliana Mutuku, who is a mammography technologist at the Aga Khan University Hospital. Juliana, welcome to Health Diary.
Thank you.
Kindly take us through what exactly is a mammogram.
A mammogram is a low-dose X-ray examination for breast.
Okay.
Yes, whereby we do it for diagnostic purposes and also screening purposes. For diagnostic purposes, it's whereby a patient has a lump and we need to evaluate further what could it be. There are lumps which can be picked at early stages, whereby they can be treated as early and patient gets better. And as well, there are lumps which are not malignant, which are benign, which we can able to pick. And also the patient can be safe and be treated accordingly, and patient managed at early stage as well. For screening purposes, for patients can come whereby they need to know their health status, and they should come annually if possible.
So who exactly is eligible for a mammogram? Can I just show up and just say, hey, I would like a mammogram, or who is eligible?
We do mammogram for ladies above 40. Yes, whereby it is above 40. Many women are eligible to high prevalence of breast cancer above 40. Yes. We can be able to advise patients to be coming screening every yearly for purposes of good health.
So take us through the process. What does it entail? When someone now walks into your office, what do they need to do? And what is this machine? Where do they stand? And I also see behind me there's a thick glass stand. So what is this?
Okay, this is a lead shield whereby it protects us from radiation when we are operating the machine, whereby when we are exposing. Yes, so it is safe, so no radiation for our techs. Yes. And also, when patient comes, we explain the procedure to them, whereby we take them through, and we do in 4 technique views, whereby first is called the craniocaudal and also in mediolateral technique. For craniocaudal, whereby patient comes in and we place the breast here, which is fit for all sizes of the breast.
So I come and put my breasts over there. Or how does one do it?
This machine is able to adjust in size depending on how the patient's size.
Right.
Yes. And also, we are able to fit any size of the breast in this, whereby we put the breast and we compress, which is not really so uncomfortable. The patient can bear.
Is it
something bearable?
Let's assume I was coming in. Am I putting 2 of my breasts here, and are you compressing both of them at the same time, or how does that happen?
We do 1 breast at a time.
Okay.
Yes. whereby we have a protocol. We start with the right, then we do the left side, and we're doing 2 views each. And also we do a tomosynthesis, whereby it can do a scan of many images for the patients, which can enhance more details on imaging.
Painful, my goodness. So it's not painful?
Not really.
Okay.
It is bearable.
Okay. Yeah. So for how long does a patient need to stand here for you to examine them?
10 to 15 minutes, depending on the patient size of breast. The small size of breast takes a bit shorter time, unlike the bigger breast.
And you happen to mention that it's only women who are 40 years and above who are eligible for this. Why is this the case?
Because the women below 40, their breasts are quite dense, and sometimes we might not pick much with the mammogram, whereby we advise them to do ultrasound.
And when you stand here and the lady stands here, so what exactly are you computing behind there?
We position the patient, then here image comes automatically, whereby you can see it on the screen. Yes.
And for you to also have this radiation glass protector, how much radiation is a patient exposing themselves to this machine?
As I said, the mammogram is a low-dose energy image, whereby radiation is very minimal, and the machine is made in a way that it has shield, yes, for protection of the patient when it's coming from the source.
Thank you so much. I have learned so much about what a mammogram is and what it entails. And I'm sure even you at home, you've learned a thing or two about this whole procedure. When we do come back, we're going to talk more and learn more about a self-breast examination and what it entails. Welcome back to the show. On the first episode, we focused on a mammogram. Now we will focus on a self-breast examination and how best is it to conduct it by yourself while at home. I'm joined by Dr. Marek from the Aga Khan University Hospital, who will take us through the process. Dr. Marek, welcome to Health Diary.
Thank you very much. Thank you very much again for having me.
Yes.
Now, breast cancer is a big problem. It's a big problem because it's the most common cancer in the world and here in Kenya.
Yes.
But we can catch it early. You had a chance to see mammogram. Mammogram is the screening tool.
Yeah.
But also what is very important is the early detection. And that's why we are talking today about self-exam. There are a few things which are very important to remember about breast. Ladies, when you look into the mirror, when you see your breast, you see the nipples, you can see the skin. And very often the most common symptoms of breast cancer, the most common signs of breast cancer are related to the shape, to the size, to the skin changes and the nipple changes. So first of all, you please look in the mirror. You can see the right, the left breast, they look similar. They're sisters. They're very hardly they look the same.
Yeah.
There could be slight difference in size, but they look similar. Now, step one, we look at the breasts in the mirror, then we raise the hands. And the breasts, they should move together. Sometimes one of them is slightly slower, stays behind. Sometimes when we raise the hand, something is pulling the breast, pulling the skin or pulling the nipple.
So how fast should you do it? Lifting of hands and...
It all depends how fast you are.
Okay.
No, but slowly enough to be able to notice the changes.
Yeah.
But step one is, let's see, do they look the same? Do they look the same size, the same shape? Or let's say similar size, similar shape? And do they move together? Is one of them lagging behind? Or is there anything happening to the nipple or to the skin?
Okay. Any other way that we can be able now to examine from what angle? Do you just touch the breast or do you touch it at an angle?
Now, there are different breasts and every lady will have different shape, different size and so on. Yeah. So, for example, these are small breasts and how we do it is right hand is examining the left breast, always. Yes? In this case, there is no need to hold the breast because this is a small chested dummy.
Yeah.
We start with the nipple, gently to pinch the nipple because sometimes there could be a lump or there could be something behind the nipple. Then flat fingers, it could be 2, it could be 3, it all depends on the size of your hand. Very gently just around the nipple.
Okay.
And now, usually the best way to do it is in a shower or in a bath when there is a bit of soap, so there is a bit of, it's a bit easier to move around. There are a few different ways, but what is very important is important to remember that when we do the self-exam, we should examine the breast. It could be in a circle. Remember, flat. Don't poke it like this.
Okay.
Don't do this because you will always find something.
Yeah.
So flat fingers, gently nipple first, and then you can do it round. You can do it left to right, top to down. Or the easiest way for me to remember is I follow the clock.
Okay.
So 12 o'clock.
Yeah.
And now what is very important, the breast tissue could be all the way up to the collarbone. Oh. Very often we just concentrate on the nipple. Thank you very much. That's the end of the story. And there is a big lump growing somewhere here.
Okay.
Yes, the breast tissue could be all the way up here. So it's very important at least to brush this area with your hand.
Okay.
And then 1 o'clock, 2 o'clock, 3 o'clock, and so on.
Yeah.
Now, sometimes the breast could be completely normal, but there could be a lump in the armpit. Okay. So what we do is relax. It's very important to be relaxed.
Okay.
Your right hand again is examining the left axilla.
Okay.
It goes up and slide down gently.
Okay.
This is the moment if there is a lump, the lump
Can we
will be able to feel it.
Okay.
And the same, we go back to the right breast. So it's the right nipple, gently, left hand is doing it, flat fingers, 2 or 3. We examine the breast, going round. Remember about going all the way up the clavicle. And then finally the armpit.
And doing the same.
Up and sit gently down.
While we're doing this self-breast examination, what exactly are we looking out for?
These are small breasts. We have 2 hands, and we used on the one hand. Now, with ptotic breasts, breasts which are slightly bigger, slightly larger, slightly going down, we use the left hand to hold the breast, and then the right hand, so let's say we have the breast tissue just between our hands.
Okay.
And during this examination, usually we should be able to feel difference between left and right.
Okay.
And now, breast tissue, or let's say breast, many ladies very often say, oh, my breasts are lumpy. Yes, it's true. Breasts should be lumpy.
What causes the lumpiness?
And in each breast, there should be up to 29 breast globules.
Okay.
So these are the lumps.
Yeah.
Now, if you examine yourself today, you may feel a lump here.
Yeah.
And it's normal. Not every lump is malignancy. Not every lump is a cancer. Now, next week, there could be a lump somewhere here because your breast tissue will react to your cycle, to your hormones.
Yeah.
The best time, and we didn't mention it yet, the best time to examine yourself is to check the breasts a few days after day 1 of bleeding.
Okay.
So this is the day
That
1.
time your breasts are very tender.
The breasts are usually tender just before the period.
Yeah.
And then, you ladies, you know that a couple of days, usually 4 or 5 days after your period, the breasts are relaxed. This is the time to examine yourself.
Okay.
This is the time to do the screening mammogram, which you discussed.
Okay.
So lumps are very common.
Okay.
Lumps, there should be lumps in the breast. Not every lump is cancer, but what is very important is to know your breasts, know your lumps. Usually I give my patients homework. Are you good with homework? I would like you to do whatever we did now at home.
Okay.
Once a week for 6 weeks.
Okay.
I would like you to find as many lumps as possible.
Okay.
If you don't find fewer than, or let's say if you find fewer than 29, you're not doing a good job. Okay. Sometimes it's impossible.
Okay.
But the idea behind that homework is to understand your breasts and understand how they are changing during the cycle.
Oh, I see. Is there any other thing that maybe one can also look out for? Other than you said the lumps which are there may not necessarily be cancerous or harmful in the long run. So if you don't find a lump that maybe would pose a threat, and then again, how would you know that lump would pose a threat to you? Number 2, is there any other symptom that one can look out for now besides the
lumps?
Yeah.
Not every lump is a cancer.
Okay.
But lumps should be examined. And the best way to examine is it's a mammogram, is an ultrasound scan.
Yeah.
Now, please, if you examine yourself and find a lump, don't panic. It doesn't have to be anything. It could be a very common cyst, benign cyst. It could be a fibroadenoma. Usually it would be a cyst.
Okay.
So usually what is very important is just to give yourself another cycle, 4 weeks.
Okay.
Usually the bleeding happens every 4 weeks.
Okay.
So let's check. Okay, I think there is something there.
Yeah.
It's not time to panic. It's just to make sure, okay, let's do it again after your next period. If it's still there, if you are not happy, if you think that there is something there, this is the time to see your doctor.
Yeah.
This is the time to investigate. This is the time to do mammogram, ultrasound scan.
And you happen to mention that nowadays even younger ladies are testing positive for breast cancer at an earlier age as compared to how it was back then. Are you seeing most of these cases?
In Kenya, we diagnose breast cancer 10 to 15 years earlier than in Europe. So, for example, most of my patients in Europe are in their 80s or even 90s. 40% of breast cancer patients here, so almost half, are very young girls in their 30s and early 40s. And this is very important for all of us to remember that it doesn't have to be cancer, but let's investigate. Let's make sure that it's nothing to worry about.
Okay.
Now, you also said, if there is no lump, what else?
Yeah.
You look into the mirror, you check the skin, you check the nipple. So there could be any changes in the nipple. Doesn't have to be cancer, but the nipple could be pulled in. We call it in our medical slang inverted nipple.
Yeah.
Very often young ladies have slightly inverted nipples, and this is the way they grew up. But if the nipple starts going back, then it could be something behind the nipple falling it. This could be cancer. Sometimes the nipple could be crying tears, clear fluid, or bloody fluid, reddish, bloody. Then this is something we need to investigate. A very common problem is milky discharge. Usually there is nothing to worry about. Again, nipple could be crusted. Sometimes it could be just an eczema, but sometimes it could be an early cancer which we call Paget's disease. Again, it has to be investigated.
Okay.
So this is about the nipple. But what about the rest of the skin? Sometimes the skin could be thicker. So the skin is usually nice and soft, but there could be one area which just feels different, harder. Yes, it needs to be investigated. Okay. I had a patient once or twice who came with a spot. Okay. Just a spot. Young ladies, or many of us, can have a spot. I had a patient who came with a spot and she said, I want it investigated. And she was right. This was cancer.
Wow. Okay.
Yes. So basically, the message to take home, any change within the skin or the nipple doesn't have to be the lump. Yeah. It's better to be safe than sorry, and it's better to investigate.
All right. Thank you so much, Dr. Marek, for your time. I have learned so much from you today. And I'm certain the viewers at home have also learned. As he said, ensure you do self-test examination each and every month to help keep the disease at bay and for early detection.
Is to make sure that your spine is stable, is to stabilize or to strengthen the core muscles, and the core muscles from the abdomen, the pelvis muscles, and the lower back muscles and the buttock muscles are supposed to be as tight as possible. And one of the ways that you can do that is by using a Swiss ball, and you just put it under at the lower part of your back. You press against the wall, make sure that you're standing straight, your spine is straight, then your knees, your feet should be flat on the ground, then you bend your knees and your hips simultaneously, and you make sure also your hands or your arms are at the right angle, and then you press against the wall and then you go down. Make sure that your tummy is as tight as possible. You can hold for 3 seconds and then you go up again. Can do as many times as possible. For starters, you can start with maybe 10 repetitions, then you can relax. As you continue strengthening your muscles, you can go to 20 repetitions, and you can do as many as possible. So you're stabilizing your core muscles, and this is making sure that your spine is stable. And we use our spine to do so many things, to walk, to stand, to sit, to squat. So this is one of the ways that you stabilize your core muscles. This is one of the ways that you keep your lower back in check. This is one of the ways that you prevent low back pain.
Thank you so much for tuning into the show today. I am certain that this show has been quite informative to you and you have learned a thing or two about breast cancer. Until next time, always ensure your health is your wealth. Bye-bye. On how to self-test yourself, no, I'm sure. Thank you so much for tuning into the show. Ensure your health is your wealth.